Hi, is it Miss Sorensen?
Yeah,
Hi, my name's Kyle.
Rachel.
I'm a student physical therapist.
Okay.
I'm going to be working with you today if that's all right.
Yep.
You said Rachel?
Yep.
Do you prefer to go by Rachel or Miss Sorensen?
Rachel's fine.
Rachel's fine?
Yep.
Okay, awesome. Well, Rachel, I guess first things first, what brings you in today?
I'm having lower back pain that's kind of affecting like my hip area as well.
Okay. Can you tell me a little bit about that? Like how long it's been going on for?
Since 2017.
2017. I saw in the intake form that we had you fill out that you've had physical therapy for it before. Is that correct?
Yep.
Okay. How long ago was that?
In 2017.
2017.
Yep.
Okay. Was there an incident that caused the back pain, or did it just kind of start happening?
I think it just kind of started happening. I'm not sure.
Okay. When you were in physical therapy for it before, how did that go? Was there anything that you liked, didn't like, anything that helped?
Things I liked and that helped in my mind were pressure against the areas that were hurting, massage, or like a hot or warm compress in the area.
Okay. Awesome. That'll help us hopefully do some of those same things, see if we can get that pain to go down.
Okay.
Just so you know, if I'm looking down and taking some notes, I promise I'm still listening. I'm just trying to take some notes so we can know what to do for our treatment and kind of making a plan going forward.
Okay.
Was there anything that you said those were some things you liked? Was there anything that you didn't like about the physical therapy before? Things that didn't seem to work out?
I just know there was like one exercise that they had me do where I sidestepped, and it instant pain. I was crying and I'm not a crier usually.
Okay.
With pain, but that triggered that response for some reason.
Okay. If you're uncomfortable with any like exercises or things we prescribed, let us know. And if anything like that happens, let us know. We'll try to avoid things that do that. You said sidestepping kind of caused that?
It was just a weird, I think it was like a fluke situation. I'm not sure.
Okay. Just in case, we'll kind of make a note of that. So back to the back pain. Have you had done any tests or imaging? Sorry, I dropped my clipboard. Have you had any like tests or imaging or X-rays on it at all?
Yeah, back in 2015, I was in a car accident.
Okay.
And had to get X-rays of my neck and back, and that's when I was told that I have lower scoliosis in like my low back tailbone area. So.
Okay. And the pain wasn't starting then because it was in 2015, but it started a couple years later.
Mm.
Okay.
That's the last time I had like an X-ray.
Okay.
So.
Good to know. That could have something to do with it. We'll keep it in mind. We'll probably do some tests and measures to kind of see where that's at and if it's gotten worse or if that's contributing to it at all.
Okay.
A little bit more about the back pain. How has it been affecting your day-to-day life?
I don't know. I don't feel like it affects it to like where I can't do anything, but.
Okay. Has it affected you at all at like work or at home?
No.
What do you do for work, if you don't mind me asking?
I nanny full time, and then on like weekends and nights and stuff, I do hair.
Oh, okay, cool. My wife's a cosmetologist, so if you ever have anything you want to talk about, I'll maybe understand a little bit. But
Okay.
well, cool. So it doesn't sound like it's affecting you too much. I saw on our intake form that some of the things that you listed that you can sometimes struggle with is standing for long periods of time, sitting for long periods of time,
Right.
and then some brisk walking.
Right.
Could you kind of describe to me like how long it takes when you're standing or sitting when that pain starts to like start or come in?
If I'm like standing consecutively, like say 5+ hours, and then I sit down to take a break, having to stand back up is a little struggle sometimes. If I'm sitting for long periods of time, it's usually after like 3 or 4 hours where I get fidgety and need to stand up and move around.
Okay. And how about? Oh, sorry. Go ahead.
And then the brisk walking. I would say it's like a build up. It's not like instant. It's like over time of
Okay.
quickly walking. So.
Okay. A little bit more on the walking. How active would you consider yourself within, say, like the past 3 months? Mild, moderate, extremely active,
Um, mild to moderate.
mild to moderate?
Yeah.
Okay. Good. Okay. So it looks like we've kind of delved into the back pain a little bit. It says on the forum that it's kind of been more of a stabbing, shooting pain.
Right.
Nothing tingling or anything like that.
Mm-hmm.
Okay. Good. Well, not good that you're having the pain, but good that we're understanding that correctly. I just want to ask you a couple questions on your family's medical history and your
Okay.
medical history, just so we can be aware of anything else that we may need to be aware of.
Okay.
I saw that you marked on your medical form that you have some family history and some personal history with high blood pressure.
Right.
Are you taking any medications for that?
Yeah, I take lisinopril for the
Lisinopril?
high blood pressure, and then I also have hypothyroidism disorder, so I take levothyroxine.
Levothyroxine. Okay. I also noticed that you marked Advil on your medications for the pain management.
Right.
How much and how often would you say you're taking that?
I take anywhere from 400 milligrams to 800 milligrams, just as needed, per the recommendation of my primary care physician.
Okay, perfect. Are there any other personal medical history or family medical history that I should be aware of?
Not that I can think of.
Okay, perfect. And then the last thing I want to do, kind of before we move on,
Okay.
I'm just going to ask you some questions, kind of about the body systems and how
Okay.
those have been functioning for you lately. I saw that you marked on our little intake form that you've been having some dizziness, lightheadedness,
Mm-hmm.
nausea, things like that lately.
Mm-hmm.
Has that been a new occurrence, or has that been happening for a while?
I would say it's been happening for a while.
Happening for a while?
Yeah.
Have you had it checked out before?
Yes and no.
Yes and no?
Yeah.
What do you mean by that?
Like my doctor is aware of it, but isn't concerned.
Okay. Cool. So we'll probably keep an eye on it, but if your doctor's not too concerned, we probably won't be too concerned either.
Okay.
Next, has everything else been, like your muscles and bones and everything, joints seem to be working okay so far? It's just kind of the back pain that's bugging you at the moment?
Yeah.
Okay, good. Have you noticed any, like, I'll say neurological problems, so like tingling going on throughout the body or feelings of losing sensation at all?
Yeah, just like when I sleep funny, but other than that, no.
Okay, so that's kind of normal.
Yeah.
I feel like that happens to kind of all of us when we sleep funny.
Yeah.
Have you noticed any balance issues within the last few months? Any falls or anything like that?
No.
Good. Any cardiopulmonary issues? So by that I mean like any like bounding heart or trouble circulation, things like that?
I typically have like cold hands and feet, but I attribute that to thyroid problems. And like sometimes my feet will swell, but I don't know.
Okay.
I'm on blood pressure medication, so I'm not too concerned about that.
Yeah, and that's kind of consistent with, like you said, the hypothyroidism and the blood pressure that can cause some of those symptoms.
Yeah.
So if you notice that getting worse at all during our treatment or anything, let me know and
Okay.
we'll take a look at it. Lastly, have you noticed any skin issues lately? Like any unknown rashes, cuts, or moles or anything like that popping up?
Mm-mm.
Good.
Nope.
Good. Okay, so just kind of my final question for you. If you had to pick the top 2 or 3 things that you wanted to get out of physical therapy while you're here, what would those be?
Probably reduce pain, and flexibility back, so I can like bend and twist and move like I'm used to.
Okay,
Get back to like my normal.
so you're saying that pain's kind of limiting
Just a
your
little bit, but not a
flexibility.
ton. Yeah.
Okay, so wanting some more flexibility, reducing that pain, and then kind of hitting those other areas we mentioned earlier with the long periods of sitting, standing, and walking.
Right.
Okay, perfect. So if you don't mind, I'm just going to kind of go through everything, kind of a quick summary, make sure I'm understanding everything correctly.
Okay.
Chime in anytime if I've missed something or if there's something that you feel like I should know about. in more detail. So he said the back pain's kind of been happening since 2017.
Right.
Doesn't sound like there was an initial event or trigger that caused it to occur.
Mhm.
Just kind of started happening. You said it's kind of a shooting sharp pain according to the intake sheet. Says that you've had physical therapy for it before,
Mhm.
and you said that things like pressure, warm compresses, and some massage helped with that
Right.
before. So we'll probably incorporate some of that into our treatment plan. He said that it's not affecting your day-to-day life at work or home, which is
No.
good. You said that you've had some imaging for your back and it found some lower scoliosis.
Scoliosis, yeah.
Yeah, scoliosis. Sorry, I said that kind of weird, huh?
It's all good.
So we'll keep an eye on that and see if that has anything to do with it.
Okay.
As far as medical history goes, things look pretty good. We took note of the high blood pressure, the hypothyroidism, and then just all the medications that you're taking for those two things, and the Advil for the pain management.
Okay.
And we mentioned the dizziness and lightheadedness and nausea and headaches that you marked on the intake form. Then those aren't really out of the normal, and that your doctor knows about those
Yeah.
and isn't too concerned, which is good. So I think going forward from this point, we just want to kind of do a little bit more tests, kind
Okay.
of testing your range of motion and your ability to move and your strength in those areas of your back,
Okay.
and see if there's anything that we need to work on as far as movement, or if it's more of a strength issue. Kind of make a game plan from there.
Okay.
But our whole plan is going to be around kind of those goals that we made of reducing the pain, getting you more mobility as far as flexibility goes, and then working on those areas that say you have struggles with, like sitting, standing, and walking for long periods of time.
Okay.
Does it sound all right with you?
Yep.
Okay, let's get it.
Okay. Thank you.